Flu season is right around the corner, and this year some doctors are warning that not only could it start earlier, but we could also get more infections.
And this prediction comes from looking at Australia. That's where the flu season has just come to an end. That country had its worst flu season in 5 years. CBS source Carly Barnett spoke to Broward Health's chief medical officer.
Flu season has only just begun, but in Australia, it's already in full swing, running from April to October. So what does Australia have to do with us? Dr. Joshua Lynch's chief medical officer at Broward Health explains.
Inform what we see during our flu season, mainly by Australia and New Zealand and the other part of the world, where seasons are flipped. So what they're seeing there is a higher incidence of flu cases than they had seen in years prior.
In fact, data shows Australia has had its worst flu season in 5 years. According to the Australian Department of Health's annual flu report, in 2021, there were only 3 patients hospitalized due to flu and no deaths. But this year, there have already been 1,708 hospital admissions and 288 deaths. After 2 years of milder than average flu seasons, due to people taking more precautions during the pandemic, this year in the U.S. could prove to be more severe.
What we may see is we may, in fact, see a blip up in terms of the incidence because of the sort of COVID fatigue. You know, many places have walked back the mask mandates, and without making a commentary on that, the simple fact is, as was mentioned, having the masks in place over the last couple of years has really tamped down the number of flu cases that we've seen.
Dr. Lynch says the good news is there should be less risk of the twindemic, referring to a combination of COVID and flu, since their COVID hospitalizations are down and more people have had immunity through vaccines or previous infection. Carly Barnett, CBS 4 This Morning.
And something to keep in mind, there may be a lot of overlapping symptoms between the flu and the Omicron variant of COVID, the stuffy nose, a sore throat, headaches. So when in doubt, stay home if you are sick and call your doctor to ask if you need to come in and be treated. Dr. Lynch recommends people get their flu vaccine in September or October.